Hi, once again welcome back to Obstetrics and Gynecology videos. Today we are going to see about the low birth weight babies. First let us see what is birth weight. Birth weight is the first weight of the fetus or newborn obtained after birth, and it's having high significance or importance because it is a single most important determinant of the survival of the baby, growth and development of the infant. So by assessing the birth weight, we can tell about the future growth and development of the baby, and even the chance for survival of the baby also we can predict. And another one, it gives or it reflects on the health status of the mother during the antenatal period, and it will give you a picture about the health status of the lady during the adolescent period and during the time of pregnancy also. Now we can see what is low birth weight. Any infant with a birth weight of less than 2.5 kg within 1 hour of birth, regardless of the gestational age. That is within 1 hour, if you are taking the birth weight of the baby, and if it is less than 2.5, we are calling it as low birth weight. And we can grade this low birth weight into 3 categories on the basis of the birth weight. That is, if the weight is between 2000 to 2500 kilogram, we are telling it as low birth weight. And if it is between 1000 to 2000, we are calling it as very low birth weight. And if it is less than 1000, we are telling it as extremely low birth weight. And if you are plotting it on the growth chart, if it is coming more than 9%, we are calling that baby as large for date. And if it is between 10 and 9, that is appropriate for gestational age, appropriate for the date. And if the weight of the baby is less than 10%, we are calling it as small for date babies. And now let us see the incidence of this low birth weight. More than 20 million infants worldwide, that is around 15.5% of all the babies born are low birth weight babies. And if you are telling about India, as per the WHO, the incidence of low birth weight in India is 33% each year. And prematurity is the world's single biggest cause of newborn deaths and second leading cause of child death after the pneumonia. So the prematurity is also a thing that is leading to the low birth weight, and this prematurity is the biggest, or it's a main reason for the death of the newborn, and even second reason for the death of the child also. Next, we can see another classification of this low birth weight. Two types are there based on the origin. One is preterm, that is, if the birth of the baby is occurring before 37 completed weeks of gestation, that baby we are calling as preterm baby. And this is the reason for around 1/3 of the low birth weight babies, this preterm, prematurity. That is the reason for 1/3 of the low birth weight. And another one is small for date or intrauterine growth retardation. That is, if the weight of the baby is less than 10% when comparing with the gestational age, that baby we are calling as small for date and or intrauterine growth retarded baby. And this is the reason for the balance 2/3 cases of low birth weight neonates. Now let us see the causes of low birth weight. See, this low birth weight includes two groups, already I have told you, that is preterm babies, those who born below 37 completed weeks of gestation, and IUGR, intrauterine growth retarded babies are also there. And 50% of the low birth weight causes, actually it is unknown, and balance 50% is due to the medical and social causes. So these medical causes include, again we can classify into maternal causes, placental causes and fetal causes. The maternal causes include all high risk mothers except the diabetes. That is, if the mother is having hypertension, or if the mother is having autoimmune disorders, or if the mother is having HIV, or if the mother is having cancer, and if they are taking chemotherapy. In all these cases, there is a chance for low birth weight babies. And second thing is placental causes. In the case of placental causes, the reasons include placenta previa and congenital defects of the placenta. Placenta previa means the placenta will be low located, or low lying placenta will be there. So the placenta will be near to the internal os of the cervix. Usually it has to be there in the fundus of the uterus, but here it will be near to the internal os or near to the cervix. So in that case, there is a chance for frequent bleeding, and because of that bleeding, the baby may get the less weight. And another one is congenital defect of the placenta. Sometimes one lobe of the placenta may be absent, or sometimes calcification of the placenta will be there. In such cases also, placental supply will decrease, and that may leads to the growth retardation. And next one is fetal causes, that is multiple gestation, hydramnios, and intrauterine infection. If multiple pregnancy is there, means whatever the nutrients and other minerals which are getting for the baby is supposed to be shared for two babies. So there is a chance for growth retardation. And another one, presence of polyhydramnios, and if the baby is getting any form of infection during the uterine life, that also may leads to the decreased weight of the baby. And next one is social causes, that is poverty, illiteracy, ignorance. In all these cases, the mothers may not take food properly. In poverty, they may not be having money or financial status to meet the expenses. In illiteracy and ignorance, they will avoid. In illiteracy, they may not be knowing what to take and how to take, how much should be taken, all those things. And in ignorance, they may be least bothered about the baby and even about the health status of, even about her own health status. And another one is poor standard of living, lack of knowledge about the family planning. That is, even if they are having well background also, economically, even if they are good also, if they are not having proper knowledge about the family planning, there is a chance for frequent pregnancies. And if the frequent pregnancies are coming, the mother's health status may get affected, and there is a chance for low birth weight baby. And early miscarriages, smoking extra, that is early miscarriages means frequent abortions. If abortions are occurring, that also will affect the health status of the mother. So in the next subsequent pregnancy, if already weak mother, if she become pregnant, there is a chance for low birth weight. And smoking, of course, it will produce a low birth weight because it will produce a narrowing of the blood vessels or constriction of the blood vessels. So the placental supply will decrease because of this constriction of the blood vessels, and that leads to the low birth weight of the baby. Next, we can see the problems of the low birth weight preterm babies. In the case of low birth weight preterm babies, there is a chance for birth asphyxia, hypothermia, feeding difficulties, chance for getting infections, hyperbilirubinemia, respiratory distress, retinopathy and prematurity, apneic spells, intraventricular hemorrhage, hypoglycemia, and metabolic acidosis. These are the complications or problems you can expect in the case of low birth weight preterm babies. And in the case of low birth weight small for date babies, we can expect the complications that may arise are birth asphyxia, meconium aspiration syndrome, hypothermia, hypoglycemia, infections, and chance for getting polycythemia. So in these babies, you should suspect this, and you should take measures for preventing this, and continuously you have to monitor the baby for the occurrence of these complications. Next, we can see the care of low birth weight babies. Actually, the care of low birth weight babies also depend on the weight of the baby. If the baby's weight is between 2000 to 2500 gram, we can give care at home itself. Only the thing, we need to give special care at home. And if the weight is less than 2000 grams, the baby requires special care at the hospital. And if the baby's weight is less than 2000 gram, but that is above, but it should be about 1800, and if the baby is stable, hemodynamically stable, other complications are not there for the baby, in that case you can go for the kangaroo mother care. So first let us see about the care of the baby, those who are having more than 2000, that is special care at home. So when you are giving care for these babies at home, we have to give importance to the prevention of infection, prevention of hypothermia, and correction of malnutrition. So for the prevention of infection, always when we are handling the baby, we should be careful. So the minimum handling should be there. Only one caregiver or the mother, only few people should handle the baby, because the chance for getting infection is more for these babies. And when you are handling the baby, even if you are taking the baby, or even if you are holding the baby, even before feeding, breastfeeding, all those things, always you should wash your hands very perfectly with soap and water, and the room should be warm and it should be dust free, and all the immunization also we are supposed to give to the baby at the correct time. Next one is prevention of hypothermia. These babies already we have seen there is a high chance for getting hypothermia for these babies. So for these babies actually till they are attaining 2500 grams we are not supposed to give bath for the baby, and always we should cover the baby with a dry warm cloth. And if you are feeling as like the warmthness is not enough, you can fill the bottles in with warm water, and these bottles you can cover in a thin cloth, and this you can keep on the sides of the baby. Otherwise you can put on a bulb which is having 60 volt, that is 60 candle bulb you can burn, so that way increase the room temperature. And correction of malnutrition. This low birth weight babies already they are weak, so when they are sucking over the breast very easily they will get tired. So what we can do means for overtaking or for overcoming this tiredness, we can give the feed frequently. That is, you can reduce the interval between the feed. At a time, the baby may not be able to suck for more than 5 minutes or 10 minutes. In that case, every alternative hour, you can feed the baby. And at home, for keeping the baby warm, you can give skin to skin contact, and you can take measures for preventing the heat loss, and the room temperature also should be maintained according to the weight of the baby. If the weight of the baby is between 1 to 1.5 kilogram, the room temperature should be between 34 to 35 degrees centigrade. And if the weight of the baby is between 1.5 to 2 kilogram, the temperature should be between 32 to 34 degrees centigrade. And if the weight of the baby is 2 to 2.5 kilogram, temperature can be between 30 to 32 degrees centigrade. And if the weight of the baby is more than 2.5, the temperature can be 28 to 30 degrees centigrade. For maintaining this room temperature, you can use room heaters, or you can have the fire, or you can warm the room. And always you can keep the baby, you can cover the baby in warm clothes, you can mummify the baby. All those things you can do for preventing the heat loss from the baby. Next is the special care at hospital. In the hospital also we should take extra precautions to prevent the infection. So for preventing the infection, we can give prophylactic antibiotics for the baby. So this will prevent the septicemia. And always it is better to have a separate nurse for feeding and for toilet attending of the baby, or for cleaning the baby. So the studies are also supporting this. Evidences are telling that if the same nurse is giving feed and giving cleaning out, if they are attending the toilet of the baby, the chance for getting infection to the baby is more. And always when you are handling the baby, you should use the barrier nursing techniques, that is surgical asepsis you are supposed to maintain in order to prevent the cross infection also. And use mask, gown, gloves, all those things. So this barrier nursing will prevent the cross infection also. Next one, prevention of hypothermia. So for preventing the hypothermia, we can keep the baby in incubator. It will maintain the temperature, humidity and oxygen supply. And you can keep the baby in the incubator till the baby is getting 2 kilogram weight. And during this time, you should monitor the oxygen supply continuously, because if the oxygen supply is less, that will produce hypoxia and cerebral palsy. And if we are giving excessive oxygen also, problems will be there, because it will produce the retinopathy and of premature baby. So we are not supposed to give high amount, and we are not supposed to give low amount also. It should be at optimal level. Next is correction of malnutrition. So these babies usually they will be very weak, and they won't be having the capacity to suck the breast. So that there is a chance for getting again malnutrition, because already the baby is malnourished and baby is having less weight. So for preventing the further malnutrition, you can start the tube feeding, because the baby is in incubator and the baby may not be able to suck effectively. So you can start the tube feeding. Next one is Kangaroo mother care. Already I have told you that if other complications are not there for the baby, even if the weight is between 2000 to between 1800 to 2000, you can go for the Kangaroo mother care. And it was first suggested by Dr. Edgar Ray in Colombia. And it refers to the care of preterm or low birth weight infants by placing the infant in skin to skin contact with the mother or any other caregiver. Usually we are giving it with the mother. And the parameters that we are supposed to monitor during the kangaroo mother care are, you have to see the temperature, you have to check the temperature every 6 hours, and you have to see the respiration for the apnea, and you have to give feed for the baby once in 90 minutes to 120 minutes, and you should see the well-being, that is, you should educate the mother about the danger signs and growth of the baby. Also, you should assess if the baby is growing properly, if the baby is getting sufficient amount of nutrients. The baby will gain 15 to 20 gram per day. So if that is there, means you can make sure that okay, adequate growth is there for the baby, and you have to see with the compliance of kangaroo care also. Next is the components of kangaroo care, kangaroo mother care. First one is kangaroo position. Actually, it consists of a frog-like position of the low birth weight newborn. So where the skin-to-skin contact with the mother will be there. So the baby will be placed in between the breast of the mother in a vertical position, and the provider must keep herself in a semi-reclining position in order to avoid the gastric reflex of the infant. And this position position we are supposed to give to the baby for 24 hours in a day till the baby is gaining 2 kilogram weight. And preparation of kangaroo baby's dress, the baby's head should have a cap, and socks also should be there, and sock proof diaper should be there, and you can put an open shirt over the back of the baby, and the other area you can leave freely in order to get the free, that is front area you can leave openly. That is why I told you that you need to have an open shirt, so that will help for maintaining the direct skin to skin contact between the mother and baby, and the baby's balanced body will be supported by the kangaroo bag. And how it is preventing the hypothermia, or now let us see the mechanism of prevention of hypothermia in the kangaroo mother care. There is a thermal synchrony. If the temperature of the baby decreases by 1 degree centigrade, corresponding the temperature of the mother will increase by 2 degrees centigrade in order to warm up the baby's body. So this will happen automatically in the maternal body. And if the temperature of the baby rises by 1 degree centigrade, and the temperature of the mother will decrease by 1 degree centigrade. So always it helps for maintaining the normal temperature of the baby. Next we can see the kangaroo feeding policy. The kangaroo position is also ideal for the breastfeeding. In that position itself, you can try to feed the baby. And always you should give exclusive breastfeeding, and the feeding should be minimum at an interval of 90 to 120 minutes. And if the baby is able to suck, it should be encouraged. And if the baby is not able to suck, you can express the breast milk, and you can feed the baby with the expressed breast milk. And if the baby is unable to swallow, you can feed the baby by using the expressed breast milk. For that, you can put a nasogastric tube. Next one, early discharge. The criteria for the discharge include, you should see for the, or you should monitor the condition of the baby. If the baby is getting 4 kilograms, or if the baby is gaining 40 grams of weight in a day for constantly for 5 days. So continuously for 5 days, if the baby's weight is increasing 40 gram per day, that's a positive sign. And you should see whether the baby is well fed by the breast milk, and if the baby's temperature is getting maintained, and if there is no evidence of other illness for the baby, in that case you can see about the, or you can think about the discharge. Next, about the follow-up. After the discharge also, the kangaroo mother care should be continued at home. And for the follow-up, once daily, the healthcare provider or health worker should make a call, and they should ensure that the baby is feeding well and the baby is gaining 40 grams of weight daily. After that, once in a daily for 1 week. After 1 week, every week they have to call, and they have to inquire about the condition of the baby for the next 40 weeks of post-conceptional age. Now we are going to see the benefits of kangaroo mother care. First, let us see the benefits for the baby. The baby is kept warm for 24 hours, and the baby is being close with the mother. So this kangaroo mother care is acting as a natural incubator. And the chance for or risk for apnea is also less, and physiological stability will be, the baby will gain the physiological stability soon when compared with the other measures of care, and the baby will get the safety and love. So this will help for establishing the bond between the mother and baby, and it will promote the growth of the baby, and the chance for getting nosocomial infection or hospital infections are also less when we are practicing the kangaroo mother care. And next we can see the benefits for the mother. The mother will become active and she will start to get involved in the baby care, and she will be more relaxed, confident and empowered, and but the bonding between the mother and baby will increase, and breastfeeding also will become successful. Next, benefits for the family. Kangaroo mother care is economical when compared with the cost of hospital care. If you are putting the baby in an incubator, it will be more expensive. So when comparing with that, the kangaroo mother care is cost effective, and better follow-up also we can have, and it promotes a bonding between the baby and the family members also. If the baby is in an NICU or if the baby is away from the family members, naturally it will affect the bonding between the baby and the family members. And benefits for the hospital, it saves materials like incubators, oxygen cylinders, and it saves manpower in terms of nursing staff. And next is the benefits for the nation. It reduces the neonatal mortality and infant mortality, and because of this we will get healthy, intelligent children. So this adds to the health and wealth of the nation. Now we can see how to prevent the low birth weight baby. For that we can use the direct intervention measures and indirect intervention measures also. The direct intervention measures includes prevention of malnutrition, that is by nutritional education and by giving supplementation under the ICDS during the pregnancy, and during the, even for the adolescent girls also we can give nutritional supplements. It helps for the prevention of low birth weight. And next is prevention of anemia. For that you can give iron tablets, and iron and folic acid tablets you can give for the mothers. Next, control of infection. Early diagnosis and prompt treatment of infections during the pregnancy, even in the preconception age also. And avoid strenuous exercise, smoking, alcohol, all those things among the pregnant woman. So these things will help for preventing the low birth weight. And the indirect measures include deciding the age at marriage. If it is an early marriage, the health status of the girl may be poor and her reproductive organs also may not be developed fully or may not be matured. In that case, there is a chance for low birth weight is there. So we can decide the age of marriage, and you can decide the age of having first child. And another important thing is birth spacing. If the interval between children, if it is less, within 1 year, if the couples are getting that another child, naturally the health status of the mother will be poor, so there is a chance for getting low birth weight. And next one is deciding the number of children. If the number of children are less, in that case also they will be able to give more support and care to the mother during the pregnancy, and even that better care will be available for the children also. And improvement of availability of health services to the woman. So this can be done, or the efforts can be taken by the side of, from the side of government. Even family members also can take effect. So all these things will, anyway, however, you are supposed to take measures for getting the better health services for the woman. Next, we can see the assessment of the low birth weight baby. If you are assessing, you can see the following features. The infant will be small when comparing with the other babies. And if you are looking into the skin of the baby, it will be thin, and the blood vessels can be easily seen under the epidermis. The blood vessels will be seen under the epidermis. The skin will be wrinkled and red with excessive lanugo and little vernix. And subcutaneous fat deposits will not be there for the baby, and the head of the baby will be large in proportion to the body. The eyes of the baby will be prominent, but it will be closed, and the ears will be soft, and chin will be receding, and thorax is less firm, and abdomen will be protruded. If you are looking into the genitalia, in the case of male baby, only few scrotal rugae will be there, and testis won't be descended, and in the case of female baby, the labia and clitoris will be prominent. And when it is coming to the extremities will be thin and muscles will be small. And if you're looking into the nail, it will be soft and short. And palms and sole, if you are looking, minimal creases, palmar creases, and for creases over the sole also will be minimal, or it may, that is, the areas will look smooth without any creases. Generally, the baby will be inactive and the baby's attitude will be extended. The legs will be extended and the hands also will be extended, and the reflexes also will not be fully developed. So here we can see the few nursing diagnoses for the low birth weight baby. First one, risk for impaired parenting related to inadequate bonding secondary to parent-child separation. If you are keeping the baby in an incubator, naturally parent-child separation will be there. So in that case, there's a chance for impaired bonding. For that, you can participate in frank discussion with parents about infant's condition, and you can allow the parents to express their fear, guilty, anxiety, and you can assist the parent with the bonding by role modeling and by staying. And you can demonstrate them how to hold the baby, how to change the diapers, and how to turn the baby. All those things you can demonstrate to the parents, and you can slowly and gradually you can make them to do all these things. This also will help for improving the bonding. Next one, imbalanced nutrition, less than body requirement related to diminished sucking. For this, feed prescribed amount of breast milk by using the nasogastric tube or by using the paladas or something. By using the spoon, you can feed the baby orally also. And you should monitor the blood glucose level. Daily we have to check the weight of the baby, and you are supposed to maintain the intake output chart. And you can keep the baby in a semi-sitting position for the feeds, that is, head and should be raised in order to prevent the aspiration, and position the baby in the right side or prone position after the feed. This also will help for the aspiration due to the regurgitation. Next one, risk for ineffective breathing pattern related to the effects of prematurity. This we can see commonly in the case of premature low birth weight babies. So in that case, you have to check the pulse and respiration every 2 hourly. You have to assess for the signs of respiratory distress, cyanosis, grunting, nasal flaring. All those things are there or not. You have to check and provide rest period between nursing care. And if you are feeling that the baby saturation is less, you can go give the oxygenation for the baby. So these are the important things regarding to in regards to the low birth weight babies. Thank you for watching this video. See you once again with a new video. Bye.